So we've all seen the headlines and the buzz on social media about the new weight loss medications and how they are going to solve America's obesity crisis. However, the hype does not paint the entire picture. With approximately 75% of the target market within the commercially insured space, employers are facing employee questions and demands for these medications. But employers simply can't afford to make coverage decisions based on hype.
That's right. So in this video, we will address 3 things that employers need to know when making smart, responsible decisions about weight loss coverage for their workforce. So first and foremost, Julayna, do they work?
The short answer is yes. Studies are showing that you can lose up to 20% of your weight on these medications, but they have to be also taken with lifestyle management changes. So you can't just take the medication alone. The studies also show that as soon as you stop the medications, the weight rapidly returns. And then we're also seeing in multiple studies that 2/3 of people are stopping the medications in under a year. That's likely because of side effects, cost, other issues. We don't know exactly why, but over and over we're seeing people stop the medications.
Wow. Well, then that brings us to our next point, which is the price tag.
Yeah, and obviously it depends, but on average you can expect to pay about $14,000 per year per patient who takes these medications.
Well, then you add that to what our data are showing, which is about 40 to 50% of our clients' workforce meet the criteria for these drugs. So that's a lot that employers are having to take on.
It absolutely is. And on the other hand, we're not showing that it's saving money through the medical cost. So I think that's what everybody was hoping for and expecting to see. The data is not showing that yet. And actually, in some situations, the data is showing that patients taking these medication are actually having increased costs, and that might be due to side effect management.
So what I'm hearing is what was expected based on the clinical trials and theory around these drugs may not necessarily be playing out in the real world as we thought at first.
Absolutely.
So the point here is that these medications are not a magic fix for the obesity epidemic that we have in this country. Is that what I'm hearing?
Exactly. Employers need to keep in mind that weight loss drugs are not intended as the primary therapy for treating obesity. It's really around a combination of lifestyle intensive changes that need to occur in addition to the medications.
So for employers, the reality is that these drugs are powerful, but we don't know enough yet about the long-term impact in the real world. So what employers need to consider is that weight loss drug coverage comes with significant financial and health impacts. The decision does not need to be taken lightly. Employers must understand the risk and benefits to make the right decisions for their people and their business. That's why employers need a trusted advisor to help them make decisions now and into the future. Our teams at Locked In are monitoring this situation very closely and are prepared to help employers make decisions as the situation evolves.